Well, hi everyone. I'm Andy Asher. I'm editor at Bloomer Boomer. Now, I was having a light-hearted conversation with a friend recently who is about my age, and I asked, what's most important to him? One of those questions that you maybe ask at a social gathering, I suppose. It didn't take him a second hardly to answer, and he said what's important to him is Social Security and looking good. Now, I was a little bit taken aback at both of his answers, but mostly his concern about looking good. What surprised me is how I feel about aging and my appearance, and I think I more or less just try to take it in stride, and I thought that's how others are. And I really realized that no matter our age, looks are still important, and appearance from a traditional point of view is, as we know, is about youthfulness, and at a certain age, we are not looking at youthfulness. So I love to hear from folks who focus on looks and appearance every single day of their lives practically. It's their career, their livelihood, and it's about appearance and how we look at ourselves and others. People in the world of cosmetic surgery, most often the case. So I'm really excited to have as my guest today Dr. Stephen Cohen, a plastic surgeon at Faces Plus, inventor of an injectable facial rejuvenation procedure that reverses the aging process by stimulating soft tissue, creating new blood vessels, and combating inflammation. Now, he says he has the secret weapon called fat grafting. Unlike filters or fillers and fat grafts, train your cells to repair themselves using new and increased blood supply. Now, we're going to talk with Dr. Cohen in just a moment. This is part of the Plus 50 Good Life movement, a project at bloomerboomer.com. That's a publication where we bring stories and ideas from authors, thought leaders, and inspirational people. It's a movement for new and evolving things that make for a Plus 50 Good Life. The shows are about what's working, what's not, and how to make the best of it. In the end, hopefully, something you can take away for yourself. Now, our guests are idea and thought leaders, experts, people with life experiences to emulate, folks with a unique expertise, or those that give us one of those aha moments or a revelation that can suddenly transform the complex and the bewildering into the understandable. So among those is our guest today, Dr. Stephen Cohen, plastic surgeon at Faces Plus, inventor of an injectable facial rejuvenation procedure that reverses the aging process by stimulating soft tissue. We'll be back with Dr. Cohen right after this. Well, our guest, Dr. Stephen Cohen, plastic surgeon at Faces Plus, inventor of an injectable facial rejuvenation procedure that reverses the aging process by stimulating soft tissue, creating new blood vessels, and continuing combating inflammation. Doctor, thanks so much for joining us. And I've been wanting to ask a doctor in your field what it must be like, because so many of your colleagues in other medical professions are dealing with the ill and things, and you're dealing instead with something that is a choice. It's certainly a different perspective, isn't it?
Very different perspective. And it's paradoxical because, for instance, the reason that we have a good practice is my background is 5 years of general surgery at places like Columbia Presbyterian in New York, 2 years of heart surgery, training at the University of Pennsylvania in plastic surgery, and UCLA in complex craniofacial and facial plastic surgery. So, when people come in here, I'm a beautician for sure, and I love what I do, but what I'm bringing to these people who are healthy and are well and are frightened is, I hope, the security of that kind of background and training because really there are very few procedures that I haven't done. So
That's
that
that. So
practice.
yeah, so I see that. So you've gone the spectrum from your other days and into this now, and you have a different relationship, I suppose, with your patients.
In many ways it's the same. You're treating people, for wellness indications. You're not treating people with diseases. In some ways, there's much more pressure on the physician and the surgeon to deliver, of course, perfect results 100% of the time. So it's in a very interesting field. I mean, having gone through a very traditional route, which most of my colleagues did, you couldn't be the surgeon you are today without having done that kind of stuff. Because unfortunately, it's still medical, it's still surgery. When somebody hops up on a table to have a facelift, for instance, you're dealing still with, the medical issues that surround these procedures. So, unfortunately, it's still very, very important to seek out properly trained people. And in addition, it's great when they have a very artistic eye and, deliver what people want.
Interesting point. The artistic eye. That makes sense. So when in my intro, I was talking about a friend that I was talking to at a get together, and I asked him things that are important to him, and how he looks. And now he's a boomer my age, and I found that interesting. And I suppose since you have that conversation on probably a daily basis, it must not come as any surprise to you.
No, it doesn't. And I think, how old are you, Andy?
I'm going to be 70 in a few months.
All right, so I mean, I'm a little younger than you, but I have the same concerns. And I think, having grown up in the boomer era, we kind of felt we could change the world. And I think a lot of us still feel very much that we're on that quest. And part of that quest is, to take good care of ourselves so that we can continue to enjoy the world that we're really trying to influence in a positive way. And I think it fits in very nicely to those strategies, providing they're done in ways that are intelligent, in my opinion. I mean, I don't like to guide people into, addiction. By the same token, my patients have explained to me what this really means. And as a man, both you and I, you and your friend, don't quite have the same perspective, because many women have told me that their drive for health, wellness, and inside beauty, how they feel about themselves, is not that much different than a man's drive, and of course today in a woman's drive for financial and reputational success in their business. So I think once you learn that, you begin to understand why people, are proactively seeking out, intelligent ways to take care of themselves. And I think we're on a precipice now that is going to change the way we think about this. And that's why I'm very excited to talk about fat grafts, because, we're really not talking about fat grafts. We're talking now about a universe of our own cells that are found in fat and all of the potentials that come along with those.
Talk a little bit more on that precipice. Do you see that as a baby boomer generation ages and new generations come into that particular age group, there's going to be a renewed attention to that?
Oh, not only renewed attention, it is going to be explosive. And I don't just mean in technical aspects of, quote, fat grafting, because what we're really doing is we're starting to now play with the body's own ability to repair and regenerate. And when you start to realize those capabilities, you begin to understand, how to plan for that, how to time that, how to develop therapies that are synergistic. And so, the superficialities of facial aging and appearance, they're oftentimes a reflection in overall aging and health in some patients. But even when they're not, the way these tissues respond to injury is not that different than other organs. So as we learn more about these newer concepts of regenerative medicine to really kind of recycle the tissues that we're gradually losing and decaying, I think we're going to find other remedies for other, ways of managing chronic disease, chronic injuries.
So that fits in with the projections that people are going to be living much longer. Some of the statistics I've seen rattled off are pretty astounding. I mean, at some point, 100 is not out of the question. So I think what you're saying is that there'll be a little bit more attention to looking your age, you might say.
Yeah, but if you really reduce it to the basics, I think it's going to be a little bit more like the way a lot of people take care of their homes. I mean, if you're fastidious, home maintenance is just part of your life. And, when the carpet gets worn down, you replace it. But, you take care of it until it's worn down. And if you happen to be of Japanese descent and you take your shoes off, your carpet may take 10 years to wear down, and mine, if I go in my work boots, may take 5 years to wear down. It's no different than the fabric of our skin. And as that wears and decays, I think the newer treatments are being designed to replace the tissues that are decaying in a very intelligent way, so that not only will we influence the appearance, but I think we will influence actually how the cell ages. And that's where the critical aspects of these things come together, because we're not just talking now about facial aging and beauty, we're talking about wellness and aging in general. And the therapies that are being designed to improve the milieu around the cells are going to be helpful, because they're not only going to improve that milieu for an appearance, they're going to help you with your muscles, they're going to help you with your heart and organ function. So what I'm talking about is a microcosm of what's going to be coming down the pike in many different areas. And that's why I say we're on a precipice.
Yeah, and you spoke about rejuvenation a moment ago, and the other area that you're involved in as far as fat grafting. So I guess the two go hand in hand in a sense.
Well, given that when you age, you have sun damage, and the sun damage basically injures the small blood vessels to the skin and also to the underlying fat tissue, which is, why we have thickness. Basically, as those vessels shrivel up, the fat doesn't have as good of a blood supply. It begins to shrink. As you start to lose the fat and it begins to shrink, you also start to lose the influence of how the muscles might load the bone. And as the muscles stop loading the bone as effectively, the skeleton begins to shrink. And as our stem cells in these tissues are depleted with age, we begin to not be able to keep up with these changes and replace these cells as they die, and suddenly we start to see exponential changes in aging. And this is what happens in all organs, but in the face, you have genetics and you're subject to, much different environments than an internal organ, which is in some ways more protected.
So the big picture is I find is fascinating. I think people who watch this will probably want to know a few particulars, and so someone, I guess they'll be at a different stage of life as to when they're considering something. Maybe step back. What do you find as the motivation initially for someone to come in and say, "Hey, doc, what can you do for me?"
Well, there are two groups of people. There's some people that, they spent their whole life taking care of everybody else, and they look in the mirror one day and they go, "My God, I look like my mother or my father. That's not how I feel." Those people, when they come in, typically are more advanced. They have findings of sun damage, they have findings of loss of volume and facial laxity superimposed on what they look like to begin with. So that's one group, and that group, fat grafting is used, in the same way to restore volume, but frequently you need more volume at that time, a little bit more extensive grafting, and you're not going to manufacture the kind of blood vessels or have as much reversal of some of the aging changes, in the underlying cells and tissues as you might have, say, treating somebody early on when they first come in and they go, I need 1 or 2 fillers. That's a different group. But in what we have shown in the older group, and when I say older, an average of around age 65, in men and women having facelifts and simultaneously restoring volume, not with an artificial or synthetic filler, but with the exact tissue that's been decayed and lost, we make new blood vessels, and we actually see those patients, their facial volume improves for at least up to 2 years. So other than when we're growing, to age 22, or God forbid if we have cancer and unregulated growth of tissue, there's no other time that we actually exert trophism. So for instance, you grow to 22, you decay gradually based on your genetics and environment. If you begin to replace these tissues early on, it's a little bit like, replacing the carpet in the house when it gets worn out. You actually introduce trophism and you begin to change that curve. Yes, you're going to still wear and tear. You're going to walk on the carpet. You're going to play. You're going to be outside in the sun, etc. But now you've actually regrown the tissue. You've replenished the blood supply. I don't know about you, Andy, but I can't think of any organ in the body that doesn't love a great blood supply. I mean, if you think about it, the heart, the brain, the kidney, we function based on nutrition being delivered to us. No nutrition, you have gradual deterioration. So these new theories are being used both in the older age group, where you can show 2 years of actual improvement in facial volume with these techniques, and in young people where this is more still kind of a theory, but it's becoming more and more convincing. As you replace these cells, what they're doing is they're basically replenishing the blood supply. So you're actually, in very small ways, you're regenerating tissue. It's not like, tearing the tail of a tadpole off and it completely regrows, but those are the same mechanisms involved, but in a smaller fashion. Hence, this has to be done incrementally. And again, when a man or woman comes in and they go, I need a filler, around my eye or in my fold or in my temple, the reason they need a filler there is not just because they've changed appearance, it's because the volume of their fat tissue, their subcutaneous fat, and in some cases even their bone, is starting to wear down and wear away. So that's the perfect person to go, it's time to put the new carpeting in, because now you're going to look like you did 10 years ago without really anything very major, because that's the other thing. Fat grafting, people think of like fat as clumpy. Fat grafting is much like fillers now. There are 5 or 6 or 7 or 8 different types of fat grafts. But what you're doing is you're modifying the fat to fit a certain shape and architecture, because when you put fat in an eyelid, it's not the same fat that you put in a cheek. You need structure in a cheek, you need cells and thinness and fine quality material under an eyelid. So the techniques that we've developed allow us to basically modify fat into 3 different types of fat grafts. One is called nanofat, one is called microfat, one is called millifat. And these grafts are put into the exact region where that fat has been lost. And the face tells you exactly what it needs and where it's been lost. Because if you get a picture of somebody from college and you look at them now, you can see the very subtle changes of losing the underlying tissue across the forehead, so the skin is thinner and there are more wrinkles, or losing volume in a temple where you start to see hollowing, or in a cheek like mine where you start to see a little bit of extra skin because the balloon is no longer filled. So I think the new strategies, especially since we've been able to take fat away from surgery, it's not a surgery procedure, it's just like a blood draw and a little needle puncture, and then the fat's modified into the different components by very simple little techniques of passing fat back and forth through a syringe. And then fat is injected just like a filler. And the beauty of this now is patients and people understand what fillers are. What is so unique about this is the decay curve continues, and that rate of decay continues. When you put a filler in, it looks better. The tissues are unaltered by the filler. They continue to age. When you put in biologic fillers like the material in fat and some of the material in blood, you actually get trophism, so you grow again, and then things start to change. So you're biologically building a new blood supply for that tissue, and it looks better. I don't know. To me, I can't even imagine why anybody would want to do anything different. And it's not that fillers go away, because fillers now, the major companies that manufacture like hyaluronic acid for all of these different companies, they're already working on adding in things like antioxidants and things that will, have more effect on the cell, because these are concepts that some of us started thinking about 14 years ago when we first began to realize that there were cells in the human body that could be utilized to treat different therapies. I mean, look at what we're doing with immunotherapy in cancer now. We're getting the body to turn on and kill the cancer, or to live with the cancer and to modulate it so it doesn't overrun us. It's no different using these cells. It's just managing the expectation so people understand what they're trying to accomplish with this, rather than, before and wow after. These things can be done, but you might not even need before and wow after if our kids start to follow some of these protocols. And this resonates big time. This is going to become one of the hottest, biggest things that have happened in aesthetics over the next 2 to 3 years. I mean, you can feel it in the air. We have defined how people age now. We're now working on how cells age, and we're going to be treating even cellular aging with some of these new techniques. So it's not just a fat graft anymore. It's tissue from us that have been modified into the appropriate location that it needs to be put. Because, you're not going to put a cinder block on the outside of a house if you want it to be a brick house and have pretty bricks.
I like that analogy. That's a good way to look at it. And how much is this an alternative, let's say, or is it totally separate from Botox that we hear so much about?
So Botox works on one thing, and that is it works on facial expression. So if you're smiling and you're creasing the skin, when you use Botox, it's kind of like putting the smile in a cast for a few months. You're not moving the muscle as much, and so the skin has time to regenerate a little bit. So Botox is used more as kind of a preventative measure and a softening effect for lines of facial expression. And this is not going to eliminate that, although some of those lines will get better over time, and there are ways of plumping up the skin so these lines are regenerated, but oftentimes in synergy with things like Botox.
Gotcha. So let's, as we wind down here, Dr. Stevens, if someone wants to pursue this, what's the process for moving forward?
Well, for us, it's really, it's a phone call to the office. We're located in La Jolla, California, in San Diego area, and we have an amazingly lovely staff. We're kind of like the UN. We treat all patients from all over the country, all over the world. I love people, and I love to be helpful to people, and I am an artist, so these things for me are really a pleasure to deal with. But the best way is really to call the office, and our website is just facesplus.com, all spelled out, and our number is in San Diego, 453 7224.
Well, great. I like your bringing up the point about being an artist, because I can see how that would really apply to what you're doing, and something I probably wouldn't have realized.
Trust me, in my case, it's all about being the artist, because the other stuff doesn't come natural, but the art stuff and the surgical stuff does. So I've been very, very fortunate that way.
Fantastic. Well, this Dr. Stephen Cohen, thanks so much. It's been really, really fascinating.
Appreciate it. You're a very good interviewer. Thanks for bringing out this information.
Thanks again. That's Dr. Stephen Cohen, plastic surgeon at Faces Plus, inventor of an injectable facial rejuvenation procedure that reverses the aging process by stimulating soft tissue. We will be right back. Well, I hope you liked the show and learned a thing or two. The full show will be available on YouTube and at Bloomer Boomer. The audio version will be available on iTunes, and we have other shows coming up with some amazing guests. Please like us on Facebook and visit us at bloomerboomer.com. Until next time, so long.